let's see. Some features and housekeeping rules for today. You're automatically muted when you come into the webinar. You cannot see the other participants in the webinar, and you'll only see the speakers and the hosts. If you have any questions, please feel free to put them in the chat box. We'll be recording this session, and it'll be available after today on our website. And we'll also have further resources posted on the centralanaaging.org. Let's see, give me 1 second. Let me get, let's see. Cornell, are you sharing the PowerPoint?
I will be. Do I have permissions?
You should be able to share.
1 second. All types of issues today, but we should be good. There we go. Can you see it now?
Yes. Okay. Let's see. Can you go to the third slide for me?
Sure can.
Okay, so we want to thank our sponsor, the North Carolina Department of Health and Human Services. And today's speaker is going to be Cornell Wright. He is the Executive Director of the Department of Health and Human Services Office of Minority Health and Health Disparities. He's a subject matter expert in health equity and disparities, minority health, and community engagement. He's currently an active member of the health community, including the Patient-Centered Outcome Research Institute, where he serves on the Clinical Effectiveness and Decision Science Advisory Panel, the Southeastern Health Equity Council, the National Partnership for Action to End Health Disparities, and serving as the co-chair to the Social Determinants of Health Committee. For his contributions to health, he's received awards and recognition from the National Institutes of Health, the Leukemia and Lymphoma Society, the North Carolina Central University for his contributions to the field of health, and the National Minority Quality Forum. And without further ado, Mr. Cornell Wright.
Thank you so much. Sorry for our delay, and I will try not to take up too much time, but I know we got a lot to cover. But I think more importantly, let me make sure, Candace, that I understand, are they going to be able to ask questions, or they have to put it in the chat?
They can put it in the chat.
Okay, so what we'll do is we'll go through a quick overview, and then we'll start, as we go throughout the conversation, feel free to start putting information in the chat at whatever point, and then we'll get to a point where we start to address those conversations. So again, I'm Cornell Wright, currently Executive Director of the North Carolina Office of Minority Health and Health Disparities, out of the Department of Health and Human Services, where Cody Kinsley is our Secretary, Mr. Victor Armstrong is our Chief Health Equity Officer and Deputy Secretary, and Angela Bryant serves as our Assistant Secretary for Equity and Inclusion. COVID is such, a part of our lives now for especially the last couple of years. So wanted to kind of go over some information and still let you know why it's important to be vaccinated and up to date with those vaccinations. And so, we know about the incredible impact that COVID has had in our communities, especially looking at, how many people have gotten COVID and then have died from COVID, especially, in the early part of the pandemic. It was so many lost lives, or so many people getting sick. And then this is before the the vaccines or other treatments that were available. And so we saw a lot of hospitalizations, deaths, and then people having adverse reactions from COVID-19. Just to level set, when we talk about CDC, we're talking about the Center for Disease Control and Prevention. FDA is the Food and Drug Administration, and then a EUA is Emergency Use Authorization. And that's important because when we started the vaccines, that's what we used to really be able to push it out and be able to help people by having that emergency use authorization for those vaccines. Coronavirus is a series of viruses that have existed for a long time, and then there's different variations of those of that virus. And one we normally connect to is what we've been seeing in the last couple of years is the COVID-19 or the coronavirus that was found in 2019. And then antibodies are things that are produced in the body, these proteins that help protect us and keep us being able to fight off illness and disease and sickness. And then the monoclonal antibodies were these infusion of those antibodies that we saw that were kind of lab created, but also help to boost our natural immunity. This is what we have been using to fight off COVID-19. And then we hear these words all the time: quarantine and isolation, right? And so for quarantining is keeping people who have been close contact with someone with COVID kind of separated. And then the isolation separates people who are contagious with confirmed excuse me, with having COVID-19 away from others, that to make sure that we don't spread that contagion. And so just a couple of quick facts about COVID-19. It was very, very contagious, and it was spreading rapidly and still is spreading. And then the symptoms can vary in terms of what we see in people or don't see. And that's what was scary about, and what is scary about COVID-19. And it's that, and then also the pieces of the puzzle of the virus is constantly mutating or it's varying. And that's important for us to understand. So when we saw things like Delta appear as a variant, and then Omicron after that, we really saw that it was spreading more quickly, and in some cases more severe with people, especially those of us that may have known someone or be someone that have pre-existing health conditions or maybe immunocompromised. And we'll talk about that in a second as well. But what we saw was that the mRNA vaccines, so your Pfizer and your Moderna vaccines, actually did the best, are doing the best to help control and maintain the virus. And so when we really dive into what we've been seeing, we know that vaccinations have greatly helped us get over some of the issues that we've been seeing. It helped stop the spread, but we didn't have enough people vaccinated up in the early parts to really kind of cut it off as much as we would want to. And so when we see that, we still understand how important it is, even now, for people who are unvaccinated to be vaccinated, and people who are vaccinated to make sure they're up to date, meaning that now you have the Pfizer and Moderna as the primary vaccines, and then using those two vaccines are greatly influence your chances to not really have issues or further complications if you catch COVID. But also there are also people that have gotten a vaccine and maybe not gone back, and letting them know that it's important to finish your series, so what we call the primary series, basically getting that first and second dose of your mRNA vaccines, and then getting the subsequent boosters in the time frame as allotted by a physician or a doctor. And then we also have seen that people have been struggling with this issue what we call long COVID, and these are more prolonged symptoms after about 4 weeks of being infected with COVID, that people are still having issues with breathing, maybe some chest pains, brain fog, and fatigue. And so being able to be connected to resources such as vaccinations and other treatments that can help um, often help prevent people from having to deal with some of these issues, but we're also keeping track on those people who have experienced like the prolonged symptoms of COVID. And how important that is to understand. And as we talked about just a minute ago, there's also some information here at the bottom where you can visit um, this website and get more information about long COVID, but we don't want people to take it lightly because it's an important issue that we are seeing. And so as we jump into more of this conversation about vaccinations and what they look like, when we talk about what's available, the three vaccines in this country that are available are the Pfizer, Moderna, and Johnson and Johnson. Ages 5 and up currently can get Pfizer. Ages 18 and up currently can get Moderna, and then ages 18 and up can get Johnson and Johnson. Differences with these vaccines is the Pfizer and Moderna are the mRNA vaccines, which is a different technology that's been used more recently for these vaccines that have been very helpful into helping the body understand what's going on and how to fight when they see something. So think about if you have a test and you get a study guide for that test. The mRNA vaccines gives the body a type of a study guide for that test that would be COVID-19. So anytime it sees anything that looks like, feels like, smells like, tastes like COVID-19, it produces different antibodies in the body to help fight what they perceive to be COVID-19. And that's a good thing. And then Johnson & Johnson uses a different type of technology, and it's a one dose vaccine initially, and then you follow up within a couple of months of getting a booster dose. As well with the Pfizer and Moderna, right now, after your 2-dose regimen, you follow up with also getting a booster dose. And so some of this conversation we won't go into right now, but when you get these slides, you can click on the hyperlinks, and you can also put your phone on, like even now, you can put your phone up to the QR code and get some of the video information and we call them Easter eggs to the information that we're sharing that goes more in depth about COVID-19 vaccines and its history. This one talks about, when we have these conversations about how quote unquote quickly it took to get here. It wasn't a quick process at all. People have been studying the mRNA vaccine process for decades, and especially people that come from North Carolina and communities that are similar to where we're from. And so this is good information to also have. And then, why should you get it is another piece. And so what we do is have interactive pieces here for you to kind of click on and go through and get the information to share with not only just your family or your friends, but people around you as well, because it's so important for us to really dive into what we're seeing. We talked about boosters just a little bit, and so right now boosters are approved for ages 12 and up, and so anybody 12 through 17 can get a booster with Pfizer. And you can mix and match your boosters. So after you get your primary series of any of the 3 vaccines we talked about, you can go back and get a booster at any one of those. The recommended vaccines are the mRNA, so your Pfizer and your Modernas. And so if you are between the ages of 12 and 17, you have to stay with Pfizer because they're the only ones approved for that age range. But if you're 18 and older, you can get any booster, but it's still recommended that you stick with an mRNA booster. So you get either a Pfizer or Moderna booster. And then you have, different time periods in which all of this plays out that we're kind of spelling out here. And, after your second dose, we're seeing that with Pfizer and Moderna, at least 5 months after your second dose, that we're asking people to get their booster shot. And then with Johnson and Johnson, it's at least 2 months after that primary dose. And this is just kind of a visual representation of what we're talking about in terms of when you can get boosted, the age ranges, where it falls for each of the vaccines, especially the Pfizer, the Moderna, and the Johnson and Johnson. Goes a little bit more in depth, and it's color coded because we like colors. We like to be able to see a nice visual representation of how we can get this information and process it. And it talks about where who you can get your booster from and at what age. Excuse me. And if you're eligible to get your booster, where that kind of where you fall in this kind of continuum of this. And this is even more. So let's walk through it. If you got your Pfizer, after your first dose, you got to wait 21 days, and then you get your second dose. And then after that second dose, 28 days later, you can get a third dose if you're immunocompromised. And these are people that have weakened immune systems, right? So this chart right here is for people that are immunocompromised. So they had a first dose, 21 days later, they had a second dose, 28 days later, they got a third dose. And then 3 months later, they were able to get a booster. With Moderna, it was very similar. You got a first dose, then 28 days later, you got a second dose. After the second dose, 28 days later, you got a third dose. And then 3 months later, you were able to get a booster. And then with Johnson and Johnson, first dose, 28 days later, you can get an additional dose. And then 2 months later, you could get a booster dose. But with the booster dose, with any of these, you can get any of these as a booster dose. I know that can be confusing. It's a lot to kind of say. It is a mouthful, but definitely we can dive a little deeper if need be. When we look at the current guidance, we know that a lot of people are relaxing mask mandates now. We've seen numbers declining in terms of case rates and hospitalizations and deaths, which is a good thing. But for many of us, we still are using our masks in more communal settings, and that's okay. And when we talk about mask wearing, we do know that the surgical mask and the N95 and the KN95 are the better options for mask wearing, as opposed to like your cloth or like just something around your face. That's not one of those pieces. And then also the important part is, if you're going to wear a mask, make sure you're doing it properly. So I just so happen to have a mask right here to show us what we're talking about. So when you wear a mask, you want to make sure that it's tight fitting around your face, right? Some people double mask, but notice like I wear glasses. So there's a little piece right here you can kind of pinch. So you're not fogging up your glasses so much. But they also have a new thing that you can spray on your glasses. You can probably get it from a local store, like Target, Walmart, or somewhere like that, CVS maybe. And you can spray your glasses that keep it from anti-fogging. That's with us, that people like me that got glasses, and that's an issue. But if you don't have glasses, you don't have to worry about this. But there's a piece right here you can kind of push in and adjust so that the fog doesn't come into your glasses too much. But also notice how my nose and my mouth are covered. That is the biggest kind of issue we've been seeing with people, right? So COVID is an airborne type of issue. So if I got the mask and not covering my nose, I'm not protected. If I got the mask and I've got this beautiful, accessory for my beard now, it's not protecting me at all. If my mouth is exposed and my nose are exposed, I'm not protected as much as I am when I'm wearing the mask properly. And then when you have like the KN95 or the N95 or the surgical mask, it even protrudes out a little bit more. So it helps with breathing. It also has a snugger fit in what you're seeing. This one's pretty, snug, but the other ones I have are even more snug, and it fits more to the face. Helps to protect you even more. And so when you wear your mask, just make sure you're covering your nose and your mouth and that you got a snug fit. I know so many people have so many questions about how that all works, but it's really protective for you and other people if you're going to wear a mask to do it properly. And so we've seen that in a lot of cases, the cloth masks weren't as helpful, but you could put on one of the preferred masks and then put a cloth mask over it. If I mean, I've seen people be real stylish out here, especially in certain social situations, and have, you know, matching outfits with their mask, and that's okay. Just make sure you got that layer of protection, that you're covering your nose, covering your mouth, and you've got one of the preferred masks on, and then you can put whatever else on top of that, if it's a stylish thing. And so when we think about getting our shot, right, where is the information that we needed the most? And so we have a call center, which is 1-888-675-4567. That's 1-888-675-4567. And the hours of operation, Monday through Friday, 7 a.m., 7 p.m. And then Saturday and Sunday, 9 a.m. to 4 p.m. And so you can call that number and share that. It's in English and in Spanish. And so we've got coverage there. If you want to go online, go to myspot.nc.gov. That's myspot.nc.gov to really dive in and get the most latest information that you can about where you can go and find locations if you want to get vaccinated. And then also in so many different other places, just some other helpful information and tips that you may have questions about. So when you get your vaccine, what's that appointment look like? And it's, you get an appointment, you get set up, and it happens different ways. There's appointments you can do at the doctor's office. There's appointments that have been happening in communities with community-based organizations and other vendors. And so a couple of things that you want to make sure you lead with and take with in this vaccine process. So you want to make sure you get a vaccine card, right? And you see a copy of it here on the screen. That vaccine card is going to be so important. If you're going through our state system, we have a state system called CVMS, and that's the COVID Vaccine Management System. If you give them an email address when you get vaccinated, you'll be able to go back and log in on that website to find your vaccine information. Let's say you lose your card. One thing that's been helpful for me and my family is when we get our vaccine card, we take a picture of it. And then, so when you get your first dose, you should leave with a vaccine card, or at least have it mailed to you. And then when you go get a second dose and a booster dose, take that with you so they can fill it out. I went online and bought a vaccine passport. And I know that sounds weird, right? But it helps, one, protect my vaccine card. I got it in my phone. I got it in a protective space holder. And so anywhere I need to go, I just grab my vaccine passport holder. It's got my vaccine information in there. And in a lot of places, you need it to get, into different venues. I know if you go to like a sporting event or somewhere, or concert and some things, you may need that vaccine card. So you want to keep up with it, but there are some fail safes if in case you need that information, and let's say you lost your card. So if you're going through CVMS system, or the North Carolina's COVID vaccine management system, and you give them an email address, you'll be able to have an easier time, hopefully, to grab that information if you need it, especially in case if you lose it. But if you're not getting a vaccine card, then inquire about it, ask about it, make sure that that's a part of the process. I have one, my wife has one, my daughter has one. She's got both of her shots that she's eligible for because she's only 10. So even keeping up with it is going to be important. when you get to the appointment and you get the shot, what's going to happen is that it could be a varying amount of, things that happen. You could go in there and have no pain at all. I remember the initial shot for me, no pain. Um, and then later on, there was like a little soreness where they put the needle in, but I didn't even feel the needle when it went in. Other people have different experiences, right? And so for me, I didn't experience anything. I didn't really experience anything my first dose, and I got Moderna. It may be like maybe just a little soreness at the area of where they put the um, needle. The second dose, that was a different story. So the second dose, I felt good, a little soreness at first, and then almost 24 hours later, it was a low grade fever and some body chills, like some body aches, right? It only lasted for about a couple hours, but I also immediately like just stopped what I was doing, laid down, got some Gatorade, got some Tylenol. Um, that we talked about it with the person, the nurse before they put the second shot in me. It was like, hey, if you need to, just make sure you got some, a little bit of Tylenol or whatever you take. So talking to your medical professionals or your health team or people that do this for a living that know your medical situation is good to know, because I had stuff just kind of there, and just stayed hydrated, just kind of put a blanket on me for a little bit, reclined in my recliner, and just rested. Because a lot of times we just go so fast and full throttle that we don't take time to rest. I had a very similar experience when I got my booster. And so did similar things. My wife was told, she got Pfizer, and she was told to do some type of activity like walk around. So what she did, she cleaned my daughter's room, and if you got a 10-year-old child, then cleaning the room is a chore, right? So after she did that, she just laid down, and she was exhausted and spent, but she said she had some of the best sleep of her life. Some people can experience symptoms at different rates at different time frames. Within about 24, 48, usually 72 hours, any symptoms that you have, should be kind of dying down. There are some outliers to that, and there's some people who just don't have any symptoms at all. They just go through, got, both shots, boosted, and feel good, and, went back to work. Some people need to take off. So, you got to kind of know your situation, kind of plan for it, and have that backup in case you need it. So we think about some of the other pieces to the puzzle of COVID. Testing is one of them, and we know that there's been so much going on with testing, especially at the beginning of this year, the end of last year. Testing is still important, and being able to get tests is important. And so there's a site down here, ncbhhs.gov/get tested. It's a good place to go to know where there are testing sites. There's more at-home tests on the market now. You can call the federal government or reach out to the federal government and get at-home tests. And then there are also a lot of vendors across the state that are doing testing in communities. So testing remains to be important to see where we are. And then treatments that are outside of what we think about with vaccines. There's been monoclonal antibody treatments and other treatments that you may have heard about that have been available to help with COVID-19. And this is usually after someone 12 and up has gotten COVID, that you're able to get one of these treatments to prevent severe illness and death, possibly, if and you have a certain time frame in which this type of treatment is most effective. And then there's also, of course, some more websites here to help us find more information if this is a route you're thinking about taking. And then the Paxlovid by Pfizer pill is becoming available, so people can be able to have a pill to take after they've contracted COVID-19. Especially this is for ages 12 and up. And so one of the biggest areas where we need to see more connection with is our ages 5 through 11. And once that opened up, children were able to get the COVID-19 vaccine, and but we haven't seen as much uptake or confidence there that we would like to see. And at this point, vaccines are free and safe and have been tested, just like the ones for adults. And we've gone through the clinical trials, and we've seen the results, and we're still gathering information each and every day on all of this. So that's why, if you ever think like, well, guidance was this yesterday and it changed again today, it's because we're still learning each and every day. But we want to protect some of our most vulnerable populations, especially our children. But ages 5 through 11 are able to get a dose of Pfizer vaccine. And like I said, my daughter, who's 10, got hers, and she got it done at her school. And my wife went and went with her to get it done. And it was a good story for our daughter. She didn't experience any pain, didn't have any issues afterwards, and has been tested, at her school weekly for COVID, and has not gotten it, thankfully. And it's, showing a lot of protection. And so we also do the protective measures on top of not just relying on, on getting vaccinated, but also, washing our hands, which is huge with kids, right? And adults too. Like, we need a lot of adults to be washing their hands. But also understanding, wearing the mask and wearing it properly, and then, not being so close to people unnecessarily. And I know there's a lot of situations where you can't help it, but there are a lot of situations that we had to really change the way we do things. So we talked about, the temporary side effects are very similar in kids that you see in adults, if there are side effects. And then, getting vaccinated has been, is one of those things that age group, we really help stress that parental consent is important to make sure that we have the parents' consent to get kids vaccinated, and we're not just out here doing it, to children without that permission. And so with the vaccination for kids 5 through 11, they get 2 doses of the Pfizer, and they're 21 days apart, and that's important to kind of keep track of. So we kind of had like a countdown, like a little calendar of like, hey, this is when this is. And when you get vaccinated, if you're going back to the same place or it's the same kind of setup, it is helpful because they can give you a reminder card as well. And then the other area that we've seen where we needed to kind of expand information and conversations is in the adolescence age. And so we've created a website called teenvaxfacts.com, where it's geared toward younger audiences, young adults, and making sure that they have a voice in these conversations, because it is important for us to really kind of think through what we're seeing and what they're understanding, and not going through life without having that input. And so actually I'm gonna stop here and take any questions that may be available in the chat, because I did something wrong. Oh, here we go. Let me stop sharing. There we go. All right, Candace. So this is where we put you to work.
Okay, so it looks like, how will the new variant occurring affect others? What does it look like?
So we're still keeping track on that new variant that we've seen in the UK. in Europe. And right now, it seems like it's declining. And hopefully we're seeing that it may not get over here, but if it does, we're hoping that it'll fizzle out and not cause too much damage. But it's one of those things that we just got to keep tracking. And a lot of this, we're still learning every day. And that's important to know, is that the more we can protect ourselves, the less we can spread COVID and other issues. And that's going to be more beneficial for us as a whole.
Okay, and I think you already answered this question. Is the COVID-19 testing is still free?
In a lot of places, yes and no. So, you know, we've seen areas where it's not free, and it's for different reasons, right? Anything that's state supported, like anything from the state of North Carolina, like their vendors, those are free. Anything outside of that, that can vary.
And then it looks like you just have a comment. The J&J vaccine, the first COVID vaccine, gave me 101-degree fever for 1 day with muscle discomfort. Onset was about 8 hours from injection. Pretty strong reaction, probably a good sign.
Yeah, you know, and I'm glad they brought that up. So when there is a reaction, I mean, if you don't have a reaction, that doesn't mean it's not working. But if there is a reaction, it means that you may have been a little close to getting COVID, you know, or at least the body is preparing you for that test of, if you got COVID or didn't get COVID, you know, you're able to hopefully fight it off a whole lot better. And so having side effects isn't necessarily a bad thing. But it does help the body prepare to be able to produce enough antibodies. And that's what we were seeing too. Some of the issues we were seeing, that the body was producing antibodies, but it wasn't enough. And so when you see the monoclonal antibody treatment, it helps booster, you know, more of a synthetic protein of antibodies that help build up, or at least carry over and cover you for a period of time, so that the body doesn't necessarily succumb to the illness by being overrun by it. So infusing more antibodies, the monoclonal antibodies, has been important in fighting this off, because like I said, it helped a lot of people not experience severe illness, death, or hospitalization. And that's important. That's what we're, you know, when we first started going out there, COVID vaccines was helping you to not even get COVID, right? But as that virus mutated and started learning and started processing and seeing where I could poke holes into here, and kind of unlocking the secrets of the vaccine, it, you know, a few other things happened, and the variants, you know, mutated, and were able to penetrate in some cases and get people sick, and people put in the hospital, and some people died. But it wasn't because vaccines necessarily didn't work. It's that they were available long enough. The virus was available long enough to kind of crack some codes in some people's immune systems, and then also depend on your environments. If you're around people and not doing some of the protective measures, it puts you more at risk, as opposed to, you know, like for me, I'm one of those people, I got a mask in my car, I got a mask at my door, I got a mask everywhere, hand sanitizer everywhere. You know, I don't even know if I see people a lot in this current COVID space. I just told somebody, Candace, the other day, I said, I haven't been on a plane since October 2019. And yeah, so I don't know if I'm looking forward to getting back on the plane or not, but it's just, I've limited my interaction in terms of face-to-face interactions a lot more than I used to. I mean, and that's just part of the process of trying to stay healthy. You can't hug everybody, you can't kiss everybody, can't eat everybody's food. Oh, that's a whole other thing. um, but but it's funny because like when you go to different scenarios, like you go to church or you go to the store, it's so weird because people start coughing and then you're looking at them like, who did that? You know, it's like you don't want to judge people, but it's just like you're more on edge, you're more anxious a little bit. So let me stop there because I'll start rambling and people be like, well, I cough, but it's just allergies. And that's the other thing too, right? You don't want people to say that this is just allergies because this is allergy season. But if you're starting to feel a certain way, make sure you just get checked or take an at-home test or do something and don't just kind of brush it off as this is nothing, that we shouldn't be mindful of.
And then you have a question here, was COVID a man-made virus?
COVID, man-made. I don't know. I'm not a conspiracy theorist or, I don't have the capacity to fully understand everything, but that is just a question I don't know the answer to. I'm not an expert in that field of what's man-made and what's kind of natural born. So I apologize for not having that answer.
Have any data been done on individuals who died that was vitamin D deficient?
That's another good question that I don't have an answer to. But that would be interesting to see because we know the vitamin D deficiency can weaken our immune systems. And so, yeah, I would love to know the answer to that one myself. Thank you.
It looks like that's all the questions we have right now.
Oh, well, we made up our time pretty well then. And then Candace, you're going to send these out to the slides out to everyone, right?
They're going to have we're going to put everything on the website.
Okay.
So, so they'll have access to that. Does anybody else have any other questions or concerns? Well, all right. Can you pull up the slides for me?
I can.
Well, first of all, thank you so much for Cornell for your time and really appreciate you speaking with us today. I just wanted to bring your attention to our upcoming webinar. It's providing long-term care for older adults in Charlotte during COVID-19. It's on March 30th from 11 to 12 with Dr. Dana Schenk, Dr. Andrea Freitas, and Kristen Wolf. So if you have any other questions or any other concerns, feel free to reach out to me or to Cornell. I'm sure he's available to answer any questions you have. I hope everybody else has a good day and a fantastic weekend.